Beginning is our senior reporter and news anchor, Chriselda Lewis. Chriselda, thanks so much for giving us this update. This is a story you've been tracking for quite a while now.
That's right.
And it feels like it was just yesterday when we confirmed the first 2 cases.
Yep.
It's been a jump.
A significant jump, Peter. In fact, this is the highest jump that we've had in the country since we reported the first case of the coronavirus in South Africa. That jump now at 128 since yesterday's figure. That's correct. So this is the highest number in terms of the figure, in terms of what it's jumped to, and quite notably as well, the Northern Cape that has been without cases since the start of the coronavirus outbreak in South Africa. It is now has its own particular cases, also the Northwest province as well, also having its own cases. We're also seeing a notable increase in the Free State. Now, you'd recall that is pertaining to that church gathering that took place, where you have now the ACDP leader, Kenneth Mishwe, who subsequently had to test, due to that gathering that had taken place. You know that a lot of questions have also been asked about following that. He met with President Cyril Ramaphosa. You'd recall that he was part of the opposition leaders who met with the president as part of this ongoing dialogue that the president is having with different stakeholders in the country. So quite a notable increase, and this is at quite a crucial time, Peter, because in the next couple of hours, as you indicated, President Cyril Ramaphosa needs to give direction on where South Africa is going in terms of dealing with the spread of COVID-19. You would recall that at the time when the president made the first address to the nation, they had to put in restrictions. It couldn't have been business as usual. And I recall quite distinctly at one of the press conferences that was held by the Health Minister, Dr. Zweli Mkhize, he said that if South Africa's numbers do not decrease over a 2-week period, South Africa would have no choice but to move to the next step. And that next step would be declaring a national state of emergency. We're not sitting there currently. Whether the president will speak about that, we really don't know. Will he declare a national shutdown? We don't know. Or a lockdown? We don't know. But certainly, I mean, if you look at between when the president spoke and when Dr. Zweli Mkhize had also said that South Africa would need to look at alternative measures if the current ones don't work, then certainly there are other measures that need to be taken into account when the president speaks to the nation tonight.
And he would have known this jump overnight. So again, that kind of pressure is sitting on his desk and his team. And also watching what Rwanda has done with just 16 cases. They've shut down the country. Nigeria, other countries are doing this. So it may be that his hand may be forced at this stage.
Oh, absolutely, Peter. He needs to be seen to be balancing between putting the lives of South Africans first and also balancing an economy that's not been doing well for a very long time. I mean, how do you balance that where the impact of the coronavirus already is starting to be felt everywhere around the world? So South Africa needs to be cognizant of quite a number of aspects. I don't think this is a decision that you can just wake up and take. You've got to take quite a number of facets into account. And as you correctly point out, I mean, we've just seen reports of the first death in Zimbabwe. We've seen reports of a death in Nigeria. So the president is not oblivious to that. He has to look at all of that. And I mean, look at what Rwanda has done. Rwanda has far more less cases than South Africa, but already they've taken those measures. So what will South Africa do? Certainly the nation looks to the president for some kind of direction this evening after he sat with all those stakeholders, the National Command Council, who he's been sitting with overnight into today. They would certainly need to come up with some kind of measures that will make South Africans stop panicking, because as the numbers continue to rise, I don't think telling the nation stop panicking is really going to work. And in particular because, I mean, some of the issues that we've been monitoring pertaining to social distance, whether South Africans are complying with what government is saying, if we're not going to listen, if we're not going to take into account the seriousness of how we're supposed to conduct ourselves as a nation, then government is certainly going to have to force its hand in forcing people to do what is required in order to ensure that we deal with the numbers that we have currently.
All right, let's take a look at these statistics here. And I'm curious about this tests counted? Because I would think that at this stage now, that number needs to double, triple as quickly as possible, because we need to understand the context. Do we know how quickly they're able to start testing people at this stage?
Peter, from the last that we had spoke, you're not going to get random testing that's going to take place. Anyone who has a cough or has a sneeze, it's going to be virtually impossible for the health department to do that. But I think testing at this point is going to be one of those crucial aspects, because if we look at where we're sitting, Peter, for example, the instance in the Free State. The Free State reminds me of what happened in South Korea. It was a church gathering very similar to what is taking place in the Free State, and contact tracing. How many people had attended that church service? How many people did they come into contact with? Do we have enough contact tracers in the country? I know that Gauteng had previously said they were trying to increase the number of their contact tracers to about 1,000, because Gauteng does remain the epicenter of the coronavirus numbers throughout the country. So what are you going to do? Do we say, okay, do we shut down just Gauteng because this is where we seem to be having a problem? Do we allow interprovincial traveling? What exactly are we going to do as a nation to ensure that there's a balancing act between protecting South Africa, protecting the country, protecting the economy? And I find it very difficult to try and strike a balance that's going to please everybody when it comes to dealing with the spread of the coronavirus. And it's moving quite fast as we see it now.
We've shut a number of borders already. Beitbridge was one that they said, listen, we can't afford to close it. But we now know that somebody has died in Zimbabwe. That's according to the broadcaster in the country. And we know traditionally there is massive movement between Zimbabwe and South Africa, but not just going through to Zimbabwe, but to countries beyond that. So might this be something that needs to be looked at as well?
Well, certainly, Peter, you know, I think at the last, when we addressed this particular issue to the ministers who are tasked with dealing with the spread of the coronavirus in South Africa, they indicated that Beitbridge, the closure of that is not in the cards at the moment. I mean, this is a gateway, not just to Zimbabwe, to South Africa, but to the rest of the continent. So, you know, it's going to be a very difficult balancing act. How are you going to ensure that there is a proper movement of goods? What are we going to do in this instance? Do we say shut down non-essential services and keep pharmacies and shops open? It's a very difficult one where we sit, Peter, and it's very difficult at this point, you know, to try and speculate about what the president will say, because there's so many issues that need to be taken into account while the panic itself is there.
Critically important. Chriselda, we're going to have to leave it there, but thanks so much for the fine work that you're doing in tracking this story for us. All right, we'll leave that there for the time being, and as we're saying that the